when they come into me, what I'm looking for specifically, how I identify it empirically, show them what's wrong with them, bring them to a chiropractic table, make a profound adjustment, and have them get up and be totally different for the rest of their life.
I've been going to the OTZ seminars. I think this is my 4th seminar, and every time it just gets better and better. I learn more and I'm able to apply more to practice.
I love this one. Practical approach, something that we can take back and implement, and it's going to hugely benefit probably every patient in my practice.
I gained a lot of clarity about how to do the techniques better, but also about the purpose for doing this kind of work and how it impacts all of the patients that have the chance to have this work done.
I got to know Dr. Murphy and his method of analysis and hearing all the stories and the way he came about this adjustment, and it just completely reframed my framework of what chiropractic can actually do.
My very first time taking this course was maybe a year or so ago, and that was my very first seminar period, so I didn't go to any of the seminar, and this was my first experience. And at that moment, it was life-changing.
I had a cardiac stent put in me in March. After that, I was doing okay and went right back to practice, but my vitality feels so much better after having had the work done. And I feel that I have a much clearer understanding about how this work impacts people and why it is so important to do, regardless of what other techniques you may be applying to patients.
Once you see the before, you see the after, and the results are immediate sometimes. It's hard to dispute that.
Getting results with the patients and the practice just grows. And it's a very unique way of adjusting that would be very hard to learn without taking our seminar, because it's counterintuitive to what you would think, and there's deep neurology combined with this, and it's a very powerful move, so you have to be very careful and give it a lot of respect.
There was this woman that flew in from Puerto Rico. She had Bell's palsy going on with her face, and he brought her in as an example, and this is my first time getting any chiropractic experience like this, and he's like, we're gonna help her today, and so I'm just literally like, okay, I gotta see this happen, because I've never heard something like this. And he did one adjustment, told her to walk, come back on break, and her face function started to come back. And so that's when I knew that chiropractic was real.
Seeing their postures improve after, minutes after the adjustment. Not only that, but their facial expressions, that was just incredible to see that change from being, just kind of, you'd think normal, to seeing them transform kind of into something a little more uplifting. He always has those little gems to give you something new every time you come back.
To see like the results people can get, and it just makes you really excited to get your hands on people and start working on it and actually use it.
Yeah, I recommend this to everybody, every single chiropractor, every single student, especially if you're a student, because you don't go down the rabbit hole of some things that may or may not work. This is a proven method that it will work, and it gets results instantly.
Every chiropractor should go to this seminar and get the exposure and the experience and see what they're doing and what's happening and how this all can be implemented into what you are already doing anyway. I think it's important that people understand what's happening here.
I would recommend it to any chiropractor that's been in practice, whether they're new, just out of school, or they've been practicing for a long time like I have.